brachial plexus injury or BRELD occurs when there's damage or trauma to the brachial plexus nerves. This can happen due to the various reasons such as direct blow to the shoulder, a fall, a motor vehicle accident, or complication during childbirth. The severity of the injury can vary ranging from mild stretching or bruising of the nerves to complete tear or avulsion. The symptoms of BRELD can vary depending on the location and severity of the injury. Common symptoms include pain, weakness, numbness, or tingling in the affected arm or hand. In more severe cases, there may be a loss of sensation of paralysis in the affected limb. It is important to note that BRELD can affect individuals of all ages, from newborns to adults. Next, cardiac tamponade. Cardiac tamponade is a medical condition that occurs when there is an accumulation of fluid or blood in the pericardial sac, which is the protective membrane surrounding the heart. This accumulation of fluid puts pressure on the heart, preventing it from functioning properly. The pericardial sac normally contains a small amount of fluid that helps lubricate the heart and allows it to beat smoothly. However, in cases of cardiac tamponade, the fluid rapidly accumulates, leading to increased pressure on the heart chambers. The symptoms of cardiac tamponade can vary depending on the severity of the condition. Common symptoms include the shortness of breath, chest pain, rapid or irregular heartbeat, low blood pressure, fainting, and a feeling of fullness or discomfort in the chest. Next, ectopic beat. An ectopic beat, also known as extracytal or premature beat, is a cardiac arrhythmia characterized by an irregular heartbeat. Normally, the heart's electrical signs originated from the sinoatrial SA node, the natural pacemaker of the heart, which regulates the heart's rhythm. However, in the case of an ectopic beat, an abnormal electrical impulse arises from a different area of the heart, causing a premature contraction. Extracytal. An extracytal, also known as an ectopic beat or premature beat, is a type of cardiac arrhythmia characterized by an irregular heartbeat. Normally, the heart's electrical signals originated from the sinoatrial or SA node, the natural pacemaker of the heart which regulates the heart's rhythm. However, in the case of extracytal, an abnormal electrical impulse arises from a different area of the heart, causing a premature contraction. Extracycle can occur in individuals with healthy hearts and are often harmless and temporary. They can be triggered by various factors including stress, caffeine, nicotine, alcohol, certain medications, or changes in the body's electrolyte levels. In some cases, underlying medical conditions such as heart disease, electrolyte imbalances, or hormonal abnormalities may contribute to the occurrence of extracycles. Flutter. Flutter, also known as atrial flutter, is a type of abnormal heart rhythm or arrhythmia that affects the atria, the upper chambers of the heart. It is characterized by a rapid and regular heartbeat, typical ranging from 250 to 350 beats per minute. In atrial flutter, the electrical signals in the heart atria become rapid and disorganized, causing them to contract rapidly and in coordinated manner. This results in a fast, regular heartbeat that may feel like fluttering sensation in the chest. Symptoms of atrial flutter can vary from person to person. Some individuals may not experience any symptoms while others may experience palpitations, a racing or pounding heartbeat, shortness of breath, dizziness, chest discomfort, or fatigue. In severe cases, or if left undertreated, atrial flutter can lead to complications such as heart failure or stroke.
Okay, so let's move on to hypotension, a condition of lower than normal blood pressure. Isang kondisyon na mababa ang presyon ng dugo or not enough of blood flow. Mga kadalasan nagkakaroon nito ay yung mga older age, being overweight or obese, not being physically active, drinking too much alcohol, and etc. Ito ay maaaring magdulot ng mga sintomas tulad ng pagsumpong, pagkahilo, pagsusuka, at iba pa. Intermittent claudication, pain in muscle during exercise caused by inadequate blood supply. The pain disappears with rest. Pananakit ng kalamnan sa tuwing mag-ehersisyo na dulot ng hindi sapat na supply ng dugo. Ang sakit ay nawawala kapag tayo ay nagpapahinga. So, ang mga kadalasang nagkakaroon nito ay yung mga may diabetes, being overweight, not being active, and drinking alcohol. So, ang mga maaaring sintomas ito ay dizziness, cramping, tingling, and etc. Mitral valve prolapse. Mitral valve prolapse, movement of the mitral valve cuffs into the left atrium when the ventricle contract. Ang mitral valve prolapse o pagkabukol ng valve sa puso ay isang kondisyon kung saan lumalabas o bumubukol ang valve ng puso na tinatawag na mitral valve kapag nagpapalpitate ang puso. Ito ay dahil sa pagkabaon o kahinaan ng ating tendons na nag-aangat ng valve. Ang kondisyon na ito ay maaaring sanhi ng mga genetic na nakadahilanan o iba pang mga problema sa puso. Kapag may mitral valve prolapse, maaaring magkaroon ng mga sintomas tulad ng panginginig ng puso, pagkapagod, hirap sa paghinga at sakit sa dibdib. Gayunpaman, hindi lahat ng mga mitral valve prolapse ay mayroong sintomas at karamihan sa mga kaso ay hindi gaanong malubha. Mga kadalasang naapektuhan nito ay mga older than 50 above and may mga Marfan syndromes at iba pa. Occlusive vascular disease, arteriosclerotic disease of the vessels, usually peripheral vessel. Ang occlusive vascular disease ay isang kondisyon na kung saan nagkakaroon ng pagbara o pagsara ng mga blood vessels sa katawan natin. Ang mga blood vessels ay mga daanan ng dugo na nagtatransporta ng oxygen at nutrients sa iba't ibang bahagi ng katawan. Kapag mayroong occlusive vascular disease, ang daloy ng dugo ay maaaring mabawasan o tuluyang mapigilan. Ang kondisyong ito ay maaaring mangyari dahil sa mga naka-accumulate na fatty deposits o mga nakasiksik na deposito ng taba sa mga blood vessels. Ito ay kadalasang dahilan ng kondisyong tinatawag na arteriosclerosis kapag ang mga blood vessels ay nabara o nagsara. Maaaring magresulta ito sa mga sintomas tulad ng pangangalay o pagkasakit ng mga binti, pagkapagod, pagkasakit ng puso at iba pang problema sa mga sirkulasyon ng dugo. Ang pagkaroon ng occlusive vascular disease ay maaaring magdulot ng mga malubhang komplikasyon tulad ng stroke, heart attack o kawalan ng dugo sa iba't ibang bahagi ng katawan. Upang ma-diagnose ang kondisyon, maaaring isagawa sa mga pagsusuri tulad ng ultrasound, angiogram o iba pang mga medical proseso. Mga kadalasang nagkakaroon nito ay yung mga may diabetes, mahilig manigarilyo, obesity, may mataas na blood pressure, at may mataas na cholesterol. Palpitation, a sensation of abnormally rapid or irregular heartbeat. Isang pakiramdam ng abnormal na mabilis o hindi regular na tibok ng puso. Mga kadalasang nagkaroon nito ay yung mga palaging stress, may low blood pressure, may caffeine, palaging uminom ng alak, at ang mga aring sintomas nito ay fainting, dizziness, unusual sweating, and chest pain.
Pitting edema is an edema that retains the impression of a finger pressed firmly into the skin. Pitting edema can have several different causes. It may be the result of localized problems with blood vessels, a side effect of certain medications, or a sign of other underlying conditions. Pitting edema is commonly caused by poor circulation or a detention of excess fluids. Some common risk factors that may lead to these problems include sitting or standing in one position for too long, low protein levels, obesity, and pregnancy. Polyarteritis nodosa is a potentially fatal collagen disease causing inflammation of small visceral arteries. Symptoms depend on the organ affected. The cause of polyarteritis nodosa is unknown. The condition occurs when certain immune cells attack the affected arteries. The tissues that are fed by the affected arteries do not get the oxygen and nourishment they need. Damage occurs as a result. More adults than children get this disease. People with active hepatitis B or hepatitis C may develop this disease. Raynaud disease, a disorder characterized by abnormal constriction of peripheral vessels in the arms and legs on exposure to cold. Women are more likely than men to have Raynaud's disease. It seems to be more common in people who live in colder climates. Raynaud's most commonly affects fingers and toes, but it can also affect other areas of the body, such as nose, lips, ears, and even nipples. After warming up, the return of blood flow to the area can take 15 minutes. Regurgitation, a backward flow such as the backflow of blood through a defective valve. Many of the symptoms that accompany regurgitation are due to the condition, such as acid reflux and GERD. Stasis means the state in which the normal flow of a body liquid stops. For example, the flow of blood through vessels or of intestinal contents through the digestive tract. Stasis, stoppage of normal flow as of blood or urine. Blood stasis may lead to dermatitis and ulcer formation.
어쩜 이렇게 시간이 안 가는지 정말 버스 안에서 going 이불 속에서 going은 언제나 너에게 going.
Subacute bacterial endocarditis is also known as infective endocarditis caused by bacteria spreading from the blood into the heart. The infection can come from various places like bacteria from the gums or from genital tract or from the exchange of dirty needles during illegal drug use. In most cases, a person's immune system, the system that fights off germs and infection, can find out bacteria in the body. In people with heart disease, it is more difficult for the body to do that sometimes. The etiology of Fallot, or called as blue baby, is combination of four congenital heart abnormalities. Kapag sinabi po kasi na congenital, ito ay disease na kasama na pagkapanganak sa baby. Tinawag na tetralogy kasi may apat na significant defect. Ito ay ang pulmonary artery stenosis, interventricular septal defect, displacement of the aorta to the right, and right ventricular hypertrophy. Thromboangiitis obliterans, or TAO, also known as Berger disease, commonly develops in smokers. Symptoms are those of reduced blood flow to an extremity, coldness, numbness, tingling, or a burning sensation. Blood vessels became blocked. This reduces blood flow to the affected areas. Blood clots may form in the blood vessels. Ultrasonography is often used to detect decreased blood flow in the affected extremity. Stopping smoking is the most important part of the treatment. A regular bacterial outgrowth on the heart valve is what we call the vegetation. The vegetations cannot damage the heart even further or break it to pieces and move to other parts of the body. Common symptoms of bacterial endocarditis are different from every person. They can range from severe to barely noticeable. These include high fevers, low fevers, night sweats, weight loss, joint pain, rash, or excessive fatigue. So kapag yung bacteria po is naipon doon sa ating heart valve, yun po yung tinatawag nating vegetation. White syndrome or WPW syndrome, a cardiac arrhythmia consisting of tachycardia and a premature ventricular beat caused by an alternative conduction pathway. Sudden onset tachycardia, sensation of heart racing, palpitations, dizziness, dyspnea, chest discomfort, piercing cold, and syncope are the clinical manifestations of WPW syndrome.
Ablation. Cardiac ablation is a medical procedure used to treat certain heart conditions, such as arrhythmias or irregular heartbeats. During this procedure, a catheter is guided to the heart, and radiofrequency energy or extreme cold is used to destroy or scar the tissue responsible for the abnormal heart rhythm. This helps restore a normal heart rhythm. Cardiac ablation is often considered when medications are not effective in managing the heart condition. Angioplasty. is a procedure that reopens a narrowed vessel and restores blood flow, commonly accomplished by surgically removing plaque, inflating a balloon within the vessel, or installing a device to keep the vessel open. Artificial pacemaker, a battery-operated device that generates electrical impulses to regulate the heartbeat. It may be external or implanted, may be designed to respond to need, and may have capacity to prevent tachycardia. Cardiopulmonary resuscitation, or CPR, is the restoration of cardiac output and pulmonary ventilation after cardiac arrest using artificial respiration and chest compression or cardiac massage. Cardiopulmonary resuscitation is an emergency life-saving procedure performed when someone's heartbeat or breathing has stopped. It involves chest compressions to maintain blood circulation and artificial ventilation to provide oxygen to the lungs. CPR can be crucial in situations like cardiac arrest or drowning until professional medical help arrives. Training in CPR is widely encouraged for the general public to enhance preparedness in emergency situations.
어쩜 이렇게 시간이 안 가는지 정말 버스 안에서 going 이불 속에서 going going은 언제나 너에게 going
Next one is cardioversion. Cardioversion is a procedure your healthcare provider uses to put your heart back into a normal rhythm. They can use a device or medicine to change your heart rhythm. A cardioversion can save your life if you're having a ventricular arrhythmia that could lead to a sudden cardiac arrest. In other cases, your provider schedules a cardioversion to prevent future problems. Next is coronary angiography. It is a medical procedure used to visualize the blood vessels of the heart, specifically the coronary arteries. It involves injecting a contrast dye into the arteries and then taking X-ray images to evaluate the presence of any blockages or narrowing in the coronary arteries. This procedure helps doctors diagnose and determine the severity of coronary artery disease. Next is coronary artery bypass graft, commonly known as CABG or heart bypass surgery. It is a surgical procedure used to treat severe coronary artery disease. During CABG, a surgeon takes a healthy blood vessel, usually from the chest or leg, and grafts it onto the blocked or narrowed coronary artery. This bypasses the blocked portion of the artery, allowing blood to flow more freely and supply oxygen to the heart muscle. Next one is coronary calcium scan, also known as a heart scan or calcium score. It is a non-invasive imaging test that measures the amount of calcium present in the arteries supplying blood to the heart. Calcium is a marker of plaque buildup in the arteries, and by measuring the amount of calcium, doctors can assess the risk of developing coronary artery disease. This scan helps in identifying early signs of heart disease before symptoms appear. Next is the creatine kinase myocardial band or CKMB. It is an enzyme found predominantly in the heart muscle. It is used as a marker to diagnose and monitor heart attacks or myocardial infarctions. When there is damage to the heart muscle, CKMB is released into the bloodstream, and elevated levels can indicate a heart attack. Monitoring CKMB levels help doctors assess the extent of damage to the heart and guide treatment decisions.
어쩜 이렇게 시간이 안 가는지 정말 버스 안에서 going 이불 속에서 going going은 언제나 너에게 going
So, ang CT angiography or CTA is a test that uses CT scan, X-ray to visualize heart in the blood vessels that goes to the heart. We inject the contrast into the vein, and as the contrast goes to the heart, you can now track the movement of the contrast in the arteries of the heart. So, konti lang po yung kailangan natin na contrast kasi magbo-block po siya sa coronary arteries that cause myocardial infarction or heart attack. And CT angiography gives us a lot of information about the heart muscle function and coronary arteries. So next is defibrillation. Use electric device to stop fibrillation by delivering a brief electric shock to the heart. So we are very familiar sa defibrillation kasi napapanood natin ito sa mga dramas. Ginagamit ng mga doktor ito pag nanganganib na ang buhay ng mga pasyente para mag-pump ulit at maging maayos ulit yung rhythm ng heart. So next is echocardiography, method that use ultrasound to visualize internal cardiac structure and test the size and shape of your heart. Doctor use this to see how well your heart pumps blood and look for the abnormalities. So, karamihan po sa mga gumagamit nito or sa mga nangangailangan is mga buntis para makita ng doktor or marinig yung kung gaano ba ka-okay yung pagpapump ng heart ng bata or may abnormalities ba. And ginagamitan po nila ito ng cool gel sa ating heart and move transducer through the gel, sending painless sound waves to our heart. And the sounds of the heart echo back to the transducer and appear to the video screen. So next is lipoprotein. Lipoprotein are conjugates of protein and lipids that transport cholesterol through the blood. And they are classified in three, such as very low density, and high density. High level of LDL in the blood is associated with arterial disease, and HDL are considered to be protective and are closely associated with decreased risk of arterial disease.
어쩜 이렇게 시간이 안 가는지 정말 버스 안에서 going 이불 속에서 going은 언제나 너에게 going.
Percutaneous transluminal coronary angioplasty. Its function is to open black coronary arteries to improve blood flow to the heart muscle. In pre-procedure, X-ray, ECG, and blood tests may be performed. After administering local anesthesia, the surgeon makes an incision in either the radial, femoral, or ulnar artery depending on the condition and inserts a catheter into the artery and guides it into the aorta. Then, a contrast dye is inserted and an X-ray is taken. If a treatable blockage is found, a thin wire is inserted and guide it into the blockage. A balloon catheter is then guided to the blockage site. The balloon is inflated for a few seconds to compress the blockage and then deflated. A device called stent may place within the coronary artery to keep the vessel open. Stress test. May mga sakit sa puso na hindi nakikita during rest. Isang halimbawa ay kapag kinukuhan kayo ng ECG or 2D echo at kayo ay nakahiga lamang or at rest. Sila minsan ay normal. And then, if there are situations wherein you have high symptoms or high suspicion of heart block in your coronary veins and the ECG and resting to the echo is normal, the doctor may oblige you to do treadmill tests. The treadmill exercise test, you will have to run so that you may get tired at the same time together with your heart. And then the doctor will monitor your ECG, blood pressure, and pulse rate, and then the doctor will assess if there are times wherein your heartbeat will weaken and you may have an abnormality in your heart. Troponin. It is the proteins in our heart that work as a team. The troponin C sticks into the calcium so that troponin I can be transported into our cardiac muscles. If one is absent among the troponin C and troponin I, contraction won't happen. Aside from these two proteins, troponin T sticks to the muscle fibers to make a good heart contraction. If a patient is diagnosed in any of the following: chest tightness, shortness of breathing, tachycardia, faintness or dizziness and fatigue, he or she may be told to take troponin tests. These tests can be a base to know how severe your condition of your heart, and therefore the doctor will know what treatment he or she will use. These are the several conditions that is present if your troponin is higher or lower than normal range, which is in 0.04 to 0.40 nanogram per milliliter. Myocardial infarction, cardiomyopathy, congestive heart failure, and stable angina.